Benign prostatic hyperplasia is probably a normal condition of aging of the prostate. If men have testosterone, in other words they have active testicles, and they get older, they will develop benign prostatic hyperplasia. And this is an enlargement of the prostate, and it's benign. It is not life-threatening. It's not a malignant process at all. It's an entirely benign process. And it impacts on men by the impact on the growth of the prostate on the outflow of the urinary tract. The prostate encircles the base of the bladder, and if it grows inwards, it will impact on the flow of urine out of the bladder. Clearly, if it grows outwards into the pelvis, it can reach a very large size and not give rise to any symptoms at all. So size isn't particularly important as far as benign prostatic hyperplasia is concerned. What matters is the area in which it grows. If we do find that it's growing inwards into the path of the outflow of the bladder, it can give rise to a constellation of different symptoms. The typical symptoms of obstruction, of blockage of the water pipe, are hesitancy of micturition, so that's when a patient will go to the toilet and actually finds he takes a little time to start to void. The flow is not as strong or as powerful as it used to be. Patients have some dribbling at the end of micturition and a sense of incomplete bladder emptying. On top of that, if the bladder becomes irritable as a result of this obstruction, patients can develop what we call storage symptoms, and these are frequency of passing urine and urgency of passing urine. And interestingly, these are the symptoms that bother patients much more than actually the typical symptoms of obstruction. So we'll often find a patient will come to see us because they're getting up at night to void more often than usual, and that they're using the toilet a bit more urgently during the day, and this is impacting on their quality of life because they are becoming increasingly toilet aware, and it's disruptive for their quality of life and their activities of daily living. The therapeutic options available for the management of benign prostatic hyperplasia are many and varied. The majority of patients can be managed with lifestyle treatment initially. So again, modification of fluid intake, reduction in caffeine intake and alcohol intake can make the symptoms much more tolerable. If the level of obstruction is not extreme, and this is normally assessed with a flow rate, then the next level of treatment would be medical therapy in the form of an alpha blocker. This tablet can be extraordinarily effective in relieving symptoms in some patients, such that they find their voiding much more comfortable and much more natural than it was, and this leads to some resolution of symptoms. If, however, the symptoms are unremitting and having a major impact on quality of life, or they've had the complications of benign prostatic hyperplasia, which include benign prostatic bleeding, bladder stones, recurrent urinary infections, or renal failure from blockage of the bladder affecting the kidneys, then surgical options then become available. The classic treatment is a transurethral resection of the prostate, where the prostate is chipped out from the inside, but increasingly alternatives to transurethral resection of the prostate are popular. These vary from presently using steam to heat the prostate all the way through to a more aggressive approach where the prostate is removed with a laser or even with open surgery to remove the prostate if it's particularly large.